The following segment is sponsored by mobi-c-cervical-disc and Dr. Michael-Peelle.
Anyone who's suffered a herniated disc, irritated spinal cord, or impinged nerves knows it can be a real pain in the neck, and that problem may stem from damage to one of your cervical discs. The good news is there's an innovative procedure that can maintain motion compared to the older fusion surgery method. Fox Carolina met up with Dr. Michael-Peelle at an outpatient surgery center in Lexington to learn more. When patients come to Dr. Michael-Peelle with degenerated cervical discs, he says they're typically dealing with two types of pain.
One is neck pain, which can be radiating to the shoulder and back of the neck. And the second is arm pain, and that can include numbness, tingling, or even weakness in the arm. Often this pain is very excruciating, debilitating, and interferes with a lot of activities of daily living.
Explaining how a cervical disc breaks down, Dr. Peelle says a degenerating disc starts to lose water.
This causes the disc to dry out. This causes the disc to collapse. It also causes bone spurs. So at times, these bone spurs are significant factors causing pain because they're pinching nerves inside your neck.
In the past, many surgery options would involve metal plates and spacers or fusion, which limited a patient's mobility. But today, Dr. Peelle says patients receiving surgery with the newer mobi-c technology may maintain motion in their necks.
The mobi-c cervical disc replacement compares to the traditional fusion surgery by actually mimicking a lot of the initial steps of the procedure. The disc is removed, bone spurs are removed, and the nerve is decompressed so patients feel relief of the arm and neck pain they're experiencing. The difference, however, is that we're not fusing the two bones together. The difference is that we're placing a mobile bearing device inside that disc to preserve motion. The ideal candidate for the mobi-c cervical disc replacement is a patient who's had intractable pain in their arm or their neck for a period of several months. This patient typically has undergone conservative care such as injections, therapy, and medication options, and yet their pain continues. This is a patient who has 1 or 2 level degenerative disc disease in the neck, of which pinched nerves are a significant factor and need to be remedied.
It's important to note every patient will experience a different post-operative activity level depending on their own factors. But for this patient, the cervical disc replacement procedure was life-changing.
If I knew somebody else had the choice between the traditional fusion surgery or the mobi-c, hands down, I would tell them to get the mobi-c, just from my personal experience, because the recovery was so quick. I'm still as flexible as I was, so it's something that I would absolutely recommend.
Dr. Peelle says the procedure is ideal for a surgery setting on an outpatient basis.
The patient arrives in the morning, has their surgery, and goes home the same day to recover.
With any surgery, there can be risks. Dr. Peelle explains the common risks from surgery with mobi-c cervical disc.
Effects of having the mobi-c surgery could include swallowing difficulty, continued neck pain, continued nerve pain in the arm, numbness or weakness.
Mobi-c is not appropriate for patients with an active infection or who are allergic to the implant materials. For information on mobi-c cervical disc, visit cervicaldisc.com. For spine care and minimally invasive surgery options, visit Dr. Michael-Peelle at spinesurgeondoctor.com.